The information I'm going to provide here will be given to you in a printout, and I will also show you on your infant how to care for the areas. When completing the 4 steps, it is necessary to have your infant lying on your lap with his or her head facing the same direction as yours. If the baby struggles, swaddling may be beneficial using a swaddler. It could be a blanket or a towel, or have a third person available. There is no need to wear gloves. Just keep your hands washed. In over 40,000 laser surgeries since 1998, I've never seen one infection develop. Tomorrow morning. You need to stretch each surgical site 3 times a day, morning, afternoon, and evening. Each stretch is 3 times for 3 seconds counting, and continue for 3 weeks or until the weight disappears. The first step is an exercise to get your child comfortable adjusting to new movements of the tongue, lip, and perhaps the cheeks. It also helps in training your infant how to suck correctly. Children over 3 months may not like this, and if you think it's stressful for your infant, you may elect to skip it. However, there's nothing in this that should hurt because you're not really pulling anything or stretching anything. It's just a gentle massage. So, step 1, post-stretching, suck training, and oral massage therapy. As I've said, complete as often as you want. Begin with a gentle cheek massage. Roll your fingers over the gum pads to get around the tongue to move it. Have the infant suck between your first knuckle and second knuckle, thinking as your nipple is your fingernail and your areola is between those 2 areas. Massage the roof of the mouth until you get just in front of the soft palate and flick the tongue up and down so that you can get the tongue to start to move. The second stretching is required to prevent the upper lip from healing back together its original form. You always want to see a straight, firm diamond. Otherwise, the lip will heal wherever you stop. Failure to adequately do this may require additional surgery. And depending on the type and degree of attachment, some infants may require a second release when they're older. The correct position for the upper lip tie post-laser surgery is, again, you want to see this diamond shape. Place your index fingers above the cut, so almost completely touching, and elevate that lip firmly to the nose. If you only go partially and create a triangle, it is going to heal back guaranteed. Also, you should use your thumb and forefingers when you pull it apart, and they should be close together, not wide apart, or you're only going to elevate the sides of the lip, and the lip will heal back together. The third procedure is also stretching and is required when the buccal ties are released. This will prevent the buccal area inside the upper cheeks from healing back to its original form. Rarely are the lower lip or lower cheeks ever released, but if they were, you would have to do the same type of stretching. To stretch the buccal or cheek, use your index finger and pull upward firmly to the eye. You want to make sure you pull straight up in the air, and again, it's 1, 2, 3, 1, 2, 3, 1, 2, 3. The tongue is the most important. You don't want to let the tongue reattach. The fourth and final stretch is to prevent the tongue from healing back to its original shape. This is often the most difficult for parents to complete. Failure to adequately complete the step will require reopening or redoing the surgery. Depending on the degree of attachment, some infants may require additional releases when they're older. If the area does heal back, you can reopen it by firmly placing your 2 index fingers in the middle of the cut and pulling or popping the area open. This can usually be done anywhere from 1 to 6 weeks after surgery. Attachment is all you need. 3 different methods of active wound management of the tongue. Method 1, if I provide it for you, is the use of the tongue guide as much. This is a new. The second method is the scoop method, where you use your 2 index fingers, get into the mouth, and what you want to do is get under the tongue and elevate it all the way up into the air. You want to get your fingers right in there and just pull up. And again, it's 1, 2, 3, 1, 2, 3, 1, 2, 3. The final area that you can use is either a wooden or plastic tongue blade, which I will provide for you. All stretches, again, are done 3 times a day for 3 seconds for 3 weeks. Most infants do well after surgery after they nurse. They are calm and happy. Some infants 2 to 4 hours after surgery, when the analgesic wear off, will cry for a few minutes or a few hours. This is not abnormal, depending on the surgery and the infant. After surgery, as indicated in your consent, you should see your lactation person and consider a chiropractor or craniosacral therapist for some body work. If you feel your infant is having discomfort after surgery, you can try placing a few drops of the clove coconut oil combination I gave you on your hand and rub it directly into the cut with your finger. You can also have babies who are crying stop by placing some sugar water solution on your finger and have your infant suck on it. You can make this yourself, just a small cup with a teaspoon or 2 of sugar, or you can use your breast milk, and that works fine also. Lastly, if you're up against the wall and you really feel your baby is uncomfortable and they're more than 2 months old, you can use Tylenol, and these are the doses. Under 11 pounds, 1/4 of the dose, 1.25 mil, and half the dose above 12 to 17 pounds. Common questions that I get after surgery: some children, if they're mobile, will fall and hit the lip and it bleeds. Don't panic. Just place a cold mist, non-herbal tea bag over the area for 4 minutes. Just make sure it's non-herbal, and don't peek every few seconds or it will continue to bleed. Although your infant may have nursed perfectly after surgery, some babies will go on a 24-hour strike when you get home. If this occurs, either spoon or drop or feed your baby. This helps if the infant is upset or hungry and will prevent your infant from becoming dehydrated. It is normal for some infants to drool more after surgery because the tongue is moving around, and if it's an older baby, they may be teething. Finally, if the upper lip appears to be swollen, which usually does not occur, but it's actually the lip being more full since it's no longer tethered, but you can put a cool washcloth on the area and on and off for about 5 minutes. Read all the directions you receive carefully, as they will usually answer the most common questions. Read the red sheet. That has the most common questions people call me about.